Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, there are about 7 weeks left in the session before the legislature takes its summer break. We have Senator Mike Brubaker here. He's going to bring us up to date on what's going on in the legislature, and then Carolyn Scanlan will provide us with an important health care update. We'll see what's going on with the hospitals in the state. All of that following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we're continuing our discussion with lawmakers, getting an update on what's going on in the Pennsylvania legislature. About 7 weeks to go. We run up on the deadline where the legislature is supposed to pass a budget. They've been able to do that the last couple of years. We'll see if they can manage it this year. Joining me is Senator Mike Brubaker. He's chairman of the Senate Finance Committee. Been on the program before. Senator, welcome.
Terry, it's great to be with you, as always.
Pleasure.
Thank
All right,
you.
let's before we get into the budget, specifically, you got a whole bunch of things I think you want to deal with. Your colleagues in the House may send you some surprises. You know, one nice thing about the legislature, you know what happens in either chamber. But what do you think is primarily going to occupy your time?
Well, as you said, budget by far is number one, right. And that might occupy 90% of the oxygen in the room between now and June 30. And it is a major priority for this governor, as it is for me, to get a budget done on time. So that means June 30. And I think last year it was about an hour or two before June 30 when he actually signed the budget.
You made the deadline. All right, one of the things that, in addition to that, I want to get into before the budget has to do with, you know, state police and their operations. There's sort of two aspects to it. One is we hear some criticisms from places that supply, you know, have their own police forces that, you know, state police have to serve areas, you know, that where small municipalities or rural can't provide it. Is that a really big debate, or is that just, what's your sense? You live in a community where you probably have a little of both, no? Or are they all?
Yes, I do live in Lancaster County, and Lancaster County does indeed have both. We have local governments, about 60 local governments in Lancaster County, and most of those have their own police force. Right. Some do not, and when you don't have your own police force, then your primary coverage is the state police. Yeah. So the state police budget is declining. I'm very concerned about that. We're going to be retiring as many as 200 or 300 troopers in the very near term, and we don't have enough. And the only way to become a trooper is to go through the cadet class. Correct. And the current cadet class coming in has 90 cadets. So we're not keeping up with the retiring troopers, and that means we're going to have a declining force. We have a force that's down about 400 now, on its way to down 600 troopers. That's concerning to me and ought to be concerning to every member of the General Assembly.
I think it will be. Now, does that mean you'll have to reduce barracks, or what does that mean? I mean, we obviously concerned about crime and, you know, protecting the lives of Pennsylvanians. Does that have anything to do with the physical plant?
It may. There is a proposal by the state police to reduce a barracks or two, and one of those plans is to reduce some of the infrastructure right in Lancaster County. So the state delegation of Lancaster County asked myself and the two representatives who have the brick and mortar in their districts to take the lead on this. Right. But we're working cooperatively as a state delegation to make sure that the state police are fully aware of our desire. So we would like Troop J in Lancaster County to remain a troop. Right. So we're having, there's going to be a hearing by the House and Senate Judiciary in Lancaster County on May 14th.
Is that going on in other places around the state as well? I mean, is this, how large a scale is the problem?
They're focusing on two areas that they believe might have a higher complement per population. One would be the greater Lancaster area, and then one up in the northeast part of the state. Okay.
Let's shift gears a little bit. I want to get to the budget. We can certainly do that in the next segment if we don't get it done here. But I want to talk about this recurring problem with transportation funding. Everyone knows we have a problem. 7,000 miles of roads in need of repair. 25% of the bridges structurally deficient. We have the governor's commission that recommended a couple of things to do about it. Everybody wants the roads fixed. Nobody wants to pay for them. I mean, that's a fairly, you know, and we understand that. But how important do you think this problem is?
It is an immensely large problem, and it needs to be dealt with. And so the question one is transportation and infrastructure a key component of government? Yes or no?
Right.
I say yes.
Of course.
And so the answer is yes. So we must step up. The number of bridges that we have that are structurally deficient, we lead the nation in.
Oh, gee.
The average age of a bridge is 50 years. The average age of bridges in Pennsylvania is 55 years. So we have to do more on innovative funding sources for transportation. So even though I don't like tax increases,
well,
I would vote for additional funding
sure.
if it went expressly into
right.
making sure that our transportation infrastructure program is the best in the nation.
And Senator, we're talking about $1.7 billion by, there have been several studies, $1.7 billion. But the other aspect of it is that it's important not just for safety, but it's important for the economy of the state. I mean, businesses don't want to come into a state where, the roads and bridges are not kept up, where they have difficulty moving goods and services around the state. So it seems to me that it's just not just good because of safety, but it's also good for the economy.
Well, Terry, you're right. I think you're right on. When we do a major road and or bridge repair, many times, not always, but many times it is Pennsylvania jobs.
Sure.
Sometimes they come from outside, but many times it's Pennsylvania engineering companies, Pennsylvania construction companies. And I have some of those in my senatorial district. So I want the Pennsylvania jobs, but I want an infrastructure that's adequate. And so frankly, we don't have it right now.
What you're saying is you get a twofer. You get people in Pennsylvania who will put to work, and you also get the business of, companies that want to put plants, put new companies into the state are more likely to do so.
Now, on that, do we have any more time on that?
We're going to run to a break, but I want to get to the budget, the big thing. We'll get to the state budget and what the senator thinks about that following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're talking with Senator Mike Brubaker. He chairs the Senate Finance Committee. We're talking about what the legislature will be up to. Is that the way to put it? The agenda of the legislature between now and the end of the session before they take a break for the summer. All right, the budget. The governor recommended a budget of a little more than $27 billion, 0.4% less than last year, if I got that right, Senator. Parameters likely to stay the same. What will get tweaked? Go ahead.
You got it right, Terry, as you always do. You do your homework really well. It's $27.14 billion budget. That's a lot of money. The governor has a no tax increase pledge, and that's no net tax increase pledge. So there's some opportunity to move around. He's laid out a very aggressive budget plan. We're hearing from our constituents. So that's the way the deal works, as you well know. The budget, the governor goes first. Now we in the General Assembly, if we're doing our job, listen to our constituents, and we're listening.
So you think it's going to be, it'll stay, the framework will stay, the total spending will stay about the same, no new taxes, but there'll be tweaks. Is that what you're saying?
I agree with that statement 100%.
Talk about the tweaks.
The tweaks, what we're hearing is higher ed had significant cuts, as much as 30% cut. We hear from our constituents, from parents sending young people to college and paying for that 30% cut's too much in 1 year. So we're hearing that. Human services. And just yesterday, Terry, I had multiple people in my office telling me what essential services these human services are to many families. And to many of your listeners, they're hidden services because they're not utilizing them. But the families that are utilizing these human services really do indeed depend on those. The governor has a 20% cut for those. So those are the two that we're hearing most frequently about. And as we talked about in the first segment, I do believe transportation needs to be a priority as well.
But you don't think that some of the bigger, more controversial issues, given, as you accurately point out, it's budget, budget, budget. That's your big priority. whether you get into sell the liquor stores or bring up school choice, that can all, if it comes up, it can wait till the fall. Your big priority is you don't want this budget to be one day late. I think you said, what was the budget last year? What was the time, like an hour or two before the July 1 deadline?
I was with the governor when he signed the budget in the rotunda, and it, by my memory, it was an hour or two before midnight.
See, I always have this notion that as long as you get it done by the 4th, because it occurs over a weekend, sort of people are at the beach and, having cookouts, they're hanging out, they go, it's okay if it's a little late, but don't get to the 5th when you get a lot of pressure.
Terry, so $27.14 billion, that's a lot of money by anybody's definition.
Sure.
The governor's been relatively clear, and that's he's offered a budget, and he is open to some level of modification, of course, within these thousands of lines.
Sure.
But in the end, what he's not open for, and which I support, is no new taxes, not going over 27.14 and $1 billion, and Republicans and Democrats alike are not overwhelmingly ready for a tax increase in this kind of economy.
Well, one of the things also that, look, you're a co-equal branch. The governor can recommend, but as you point out, you have constituents, 49 other senators and 203 House members have constituents. So you all have concerns that have to be dealt with within the framework. And so I don't think anyone can expect that the budget exactly as the governor sent it over to you, what it was in February, will be the same. You have your priorities.
I do have priorities. There are members that will have a single priority.
Yeah.
They'll tell the governor and or the leadership, I'll only be a yes vote on the budget if I get X.
Yeah.
I've never been of that mindset. So I want to, the budget vote for me, Terry, is very hard. I voted for half the budgets, I voted against for half the budgets in the past. So it's very difficult, and I won't be a no vote on a single issue. So I'm going to you have to take this thing and put it on a scale, and it's my toughest job.
Okay.
Is that budget vote.
Before I let you go, I don't know if this is a lighter note or not, but we'll have to see. You're going to the Republican convention. I noticed that I would look around the state. You actually led the ticket in the 16th congressional district. What are you going to do there? You're going to vote. Come on now. You're going to vote for Mitt Romney. Let's not pretend anything else. He's going to ultimately win by acclamation. You're not going to have a big fight at the convention, are you?
Well,
no.
We're here a long way away from August. I certainly would not expect a big fight. It certainly looks like it's going to be Romney. But I've pledged to my constituency that I'm going to be open. So I'm going to remain open. Mitt Romney's running a very aggressive campaign. There's no doubt about it. So our convention is the last week in August.
It's
in Tampa. And
I expect to be there watching you, watching everybody and commenting about it. But
it's going to be my first convention. I'm looking
good.
forward
That'll
to
be
it.
exciting. But look, Romney's going to be the nominee. I think it'll be by, I don't know about acclamation because you have Ron Paul who may still be in the race, but I think he'll overwhelmingly be nominated. And I actually think that the party will be much more united than it is now, and it's going to be a close election. Thanks for coming on. I got the last word in that segment. All right, coming up, Carolyn Scanlan from the Hospital and Healthsystem Association for an important health care update. All of that following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program for an important healthcare debate. Carolyn Scanlan is with us. She's the president and CEO of the Hospital and Health System Association of Pennsylvania. I've kidded Carolyn for years about the length of that name, but that's okay. Don't we have fun with that, don't we?
We do.
Hospital and Health System Association. The important thing is Carolyn is one of the experts we bring on from time to talk about important policy matters. You know, you just heard Senator Brubaker talk about the health care cuts and the fact that some of them could be tweaked, maybe restored. There's been a lot of pressure from many quarters to do something about that. What's your take on that?
Well, I think it's probably a very important part of what needs to be done in the budget. This budget really does undercut a lot of services to people who are vulnerable, both on the human service side and on the healthcare side. From a hospital perspective, we view ourselves as partners with the state and federal government in regard to medical assistance and a state program called general assistance. And this budget proposes to cut the general assistance program pretty significantly. These are people who are really medically compromised, very vulnerable, and they need this program. This is really health insurance for the poor. Right. And without it, they won't get the kinds of services that they need on the ongoing chronic care as well as prevention care.
Now, let's talk about a couple of aspects of that. Number one is that you know, we don't need to get into a debate about the national health care law or not. It's before the court. The Supreme Court will probably know a little later about, by June what the disposition of that federal law is. But I think there are two considerations that I want to talk to you about. One is, folks come into the hospitals, you're required under law, if I understand it, to treat them.
Treat them when they present in the emergency
department. Well, of course, that's what I mean.
Yes.
They're in the emergency room, you got to treat them, right?
Yes.
The second element is that because they're not being treated in many cases routinely, that aggravates the situation with their health care and ultimately ends up costing more, or am I crazy?
No, you're exactly right. So if somebody doesn't have access to health care, which generally means insurance to cover going to a doctor, then they delay or avoid going to the doctor because they don't have the money to pay for it. They come to the emergency department when they're even more compromised. It does cost more money, and sometimes their health is so compromised that the hospital can't fix it anymore. And so we are really concerned about that, and this budget undercuts that kind of, the state budget that's proposed by the governor undercuts that safety net for these individuals. It undercuts it in the obstetrical area for payment for normal newborns. It undercuts it in just general payments to hospitals. It undercuts it by cutting the general assistance program so that people can't get the kind of coverage that they need. And what Senator Brubaker talked about, the human services area, it cuts funds to counties by 20%, which is for mental health, drug and substance abuse, disabled individuals, mentally impaired individuals, whole series of people who need care.
Sure. Now, one of the things that I've noticed that, let's start with the fact that it may filter from the federal government down to the state government. Medicaid, as you know better than anyone, is a joint program where you have some flexibility, but obviously money comes from the federal program and there are some requirements. But it seems that when we talk about all of the proposals that are coming out of Congress, the discussion is to cut the providers. It's like, well, they don't want to go and cut the recipients of benefits, folks who are on Medicare and Medicaid directly.
Well, part of the Affordable Care Act was something that states had to retain maintenance of effort. So that meant they couldn't change the eligibility for individuals, they couldn't change the range of services for individuals, but they could cut provider payments.
That's my point.
But when you cut provider payments, it makes it harder, particularly for a hospital, to sustain all their services.
All right, we're going to run to a break. This is an important subject matter that affects the health care of a lot of Pennsylvanians. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. Well, look, one of the things then that is necessary is that chatting with Senator Brubaker earlier, is that you're going to obviously go to the legislature and say restore some of these cuts that he admitted could get tweaked. Now, he's very cautious about how he said that. Go back to the legislature. Go ahead, take it from there.
Well, when the legislature comes back from their break and really is focused on the budget over the next 7 weeks, as you pointed out, they'll be looking at how much revenue they have to spend, what the expenses will look like, and in that process, we want them to restore the kinds of cuts we've talked about that hospitals would be sustaining in the proposed governor's budget. The areas are pretty clear. There's cuts to normal newborn births for medical assistance patients. There's cuts to hospital payment in general. There's cuts in regard to that general assistance population. And there's cuts that Senator Brubaker referred to on the 20% to the counties. All of that's really important for hospitals because we're already paid less than it costs us to care for the Medicaid patient.
Now, one of the things that I've noticed in the proposals out of Washington in particular is that they talk about, because everybody's trying to save money, well, we'll cut the providers. They're a little more reluctant to cut aid directly to people. So they say, well, we can cut the docs, we can cut the hospitals. Looks like that's carrying itself now out at the state level.
It does. I mean, there is a requirement in the Affordable Care Act for the maintenance of effort of eligibility and services for the Medicaid assistance individual. And so hospitals and other providers look like easy places to cut. But when you cut provider payments or hospital payments for medical assistance patients, you're cutting whole services that hospitals might have. If you cut the normal newborn payment for hospitals for medical assistance patients, who, by the way, are 50% of the births that hospitals see on average across the state, then the hospital may not be able to sustain its obstetrical services for everyone.
Mean close them?
That means they could consider closing them. Several years ago, a whole bunch of obstetrical units in hospitals closed because they couldn't financially keep them going. And the legislature recognized that and put some additional money into the budget. Yeah. That money is now being cut along with general payment for hospitals. It will make it hard for some hospitals that are at break even or already losing money to continue to keep those services going.
Yeah, we have about a minute left. I mean, I noticed also that when we've talked about this in the past, that we have physician shortages in a number of critical areas, OBGYNs, orthopods come to mind, maybe heart folks that deal with the heart problems. And so now you add to that difficulty with providing services in certain areas, medical areas, particularly for rural hospitals. That's going to huge a big hole in medical services in the state. Potentially, we're not saying it will. Go ahead.
It does. I mean, the hospitals are facing an aging population and more individuals on medical assistance because of the recession that we've been in. And so all of these pieces, when linked with the physician and other professionals, they're important components and all have to be adequately funded.
Thanks. Great update. When the budget's done, we'll have you back and we'll see how hospitals and the medical community has fared. All right, thanks for watching this edition of Pennsylvania Newsmakers, and as always, talking about healthcare. Stay well.